when we finally do break. But we wanted to really create lots of opportunity for further discussions. 2015 is arguably the start of a global surgery movement with DCP3, with the Lancet Commission, with the WHO resolution. There's a lot going on. So we need to understand the role of the press. And this next session is the role of the press in building global health movements. What lessons do we have within the global surgery community? So I'd like to invite Ray Price, who's going to lead on this session, and Jeff Marvin, Bridget Huber, and Eric Talbert to come and take your seat. And I'll just start off with some opening slides. Go ahead. Thank you. So how can we engage the press to build support for global surgery, for this global surgery movement? And at the meeting in Italy, one of our commissioners from Colombia said, to generate change, you must touch minds with data and hearts with faces. And I didn't quite understand well, I sort of understood what he meant, but it really hit home when I was giving an interview to the BBC World Service last week. Having never gone to the BBC in 54 years, I was there 3 times in 36 hours, and I got quite used to it, felt at home there. But I was asked to come quickly, as they always seem to be, quickly come over, and they said there'll be someone else with you, and I thought, oh, there was on the commission, and there was this guy wasn't anything to do with the commission. But he was someone who had just come back from Uganda running a fistula camp, and although it was radio, he was presenting the face of obstetric surgical patients, rather than I coming and talking about a lot of data. And of course, that was the significance. We were pleased last week that we did have a lot of coverage. 110 news agencies picked up the piece, and that was important. But let's have a debate about the role of the press. And Ray's going to moderate this session. And it's been a real delight for me to get to know Ray over the last year or so. We share 2 things in common. We seem to have a lot of kids. And we like taking our kids to interesting places. Me to Somalia, and Ray to Mongolia, to get involved in global surgery just after they've sort of come out of nappies. But I think Ray's taught me a lot, and in the conversations I've had with him, I've really learned a great deal from his work in Mongolia, and we're going to hear a lot about that tomorrow. I'm looking forward to that, to Ray. But Ray is one of many who have made that paradigm shift from surgery into global health, into public health rather, which we've been hearing about today. And I'm going to be looking forward to hearing you lead this session. We've got Eric Talbert. Eric is an executive director of Emergency USA for the last 3 years, holds an MA in media and communications, and is on the board member of the Development Executives Roundtable, and was a recipient of the Young Executive Director of the Year Award in 2012. I've heard a lot about this Oscar-nominated film on open surgery, and it's going to be good to hear your views, Eric. Welcome. Jeff Marvin is with us today, and he's the Media Relations Manager at Partners in Health, so we've had a lot of input from Partners in Health today. And also Executive Literary Editor at New England Law Review. Not quite sure how he juggles both those roles, but has had a previous member of the board of Examiners for Nursing, and brings a lot of experience working in healthcare in various settings, I think. And then Bridget Huber, who's an independent journalist, covered many areas: public health, medicine, environment, food and agriculture, and has written on behalf of a number of groups that are outlined here in the bio. So welcome to the panelists, and I look forward to Ray leading this session. Thank you.
Thank you very much. I'm excited to be here and actually sad to be here. I specifically did not go to London because my daughter was supposed to have my first grandchild last week. but she happened to deliver while I was on the plane yesterday. It's kind of like global surgery work. You just adapt and overcome. So I've been getting lots of pictures and lots of stories, and the last little text here is, when are you going to FaceTime? So as soon as we get this conference over, I need to FaceTime my new grandchild. I have learned so much from my colleagues around the country, around the world, whether it's Nigeria, Ecuador, or Mongolia. And specifically in Mongolia is where I really received my first education about the importance of the media in our global surgery efforts. It was Dr. Segerlin who asked me to teach laparoscopic surgery up in a little town called Erdenet. And as we went up there teaching laparoscopy, the hospital director came one day and said, "Would you be willing to go on the TV and do a live call-in talk show?" And like Sarnai said, I don't speak Mongolian, and I wondered how that was going to work. And then I wondered, aren't you just trying to do some self-aggrandizement of trying to market yourself? But then I sat back and thought, wait, this is a socialistic kind of society. It's a government-run system. That doesn't make sense. And I asked him, why is it you want me to do this? He said, well, because the people don't know what laparoscopic surgery is. They don't know how it benefits them. And we need to educate the population so the population will go and demand from their government financing to help support, pay for that type of health care. And it was then that we began to have, really, every time that we went to Mongolia, some way to involve the media to try to advertise what laparoscopic surgery was and how it was benefiting those people. And initially it was data-driven, but then we became, they recognized and they told us, look, you need to tell the story from the patient perspective. So with that little, and one other last little comment, I was pleased to have Dr. David Hoyt here from the American College of Surgeons. 2 years ago, here in the United States, we had a meeting looking at the International Relations Committee and the role of the American College of Surgeons internationally. And at dinner, he made the comment, Ray, I think I'm finally beginning to understand what you and the others are talking about when you say global surgery. He says, but most of the members, the 80,000 members of the American College of Surgeons, don't understand it when you say global surgery. And maybe that's part of the problem. Maybe we need to have a different name other than global surgery, because people hear that and either think it's high-priced surgeons with high-priced equipment, or people who run around the world, do a lot of fun cases and come back and feel good about themselves, which is not what we really mean. With that as an introduction, I'd like to maybe begin with a few questions. You mentioned 110 news media articles that have been generated from last week. But I looked up and you sent that news release to 1,800. So although 110 sounds successful, we sent it out to 1,800 but only got 110 to respond. My first question is, what strategies can we implement to keep the concepts of the Lancet Commission on Global Surgery at the forefront of the media to facilitate change? What is it that's going to grab them, and what do we need to get out there that's going to engage the media? And maybe we'll start with Jeff and see what you think.
Yeah, I think that's a very great point. And,
and maybe you can lean up into the mic just a little bit. It's there.
One of the best strategies, I think, to get this work out there, and I applaud the commission for this and the writers, is the report itself. It provides 5 clear messages that we can all use to really shape the way we talk about our work, to advocate for our work and the great need for this. And we can use this throughout the year, throughout going forward in every aspect of this, and just the general conversation about health system strengthening. But really this sets out the key reasons why access to safe and quality surgical services is critical, but also why the overall health system is also necessary to that. So using this and taking from this, those 5 messages, the key data that's presented here, is the best way to continue this going on. And there are these 180 media outlets that picked up on this, but going forward, this conversation doesn't end today because the panel's over. This conversation starts today, really, when we have this now and we can all be re-energized and use this as our duty to really spread this message.
So Bridget, I was glad to see you tweeting today, because then it sent me to your blog that I was able to read your last article on global surgery. what can the Lancet Commission on Global Surgery do to really engage the media, to not only report the issues, but to find ones that are champions of the issue of global surgery?
Well, I would say that in addition to what Jeff was just, talking about having the information there for a curious journalist to kind of feel like they can delve into some research and sort of see what's actually there empirically, I think that building relationships with the press is really important, and not only talking to reporters when you have a press release that you'd like to have covered. So, finding some journalists that you like their coverage, maybe you feel like they do a good job, that they're conscientious with the facts, and just trying to sort of start to establish a relationship, maybe have coffee, maybe just send them an email. So that way, you have sort of their ear, right, at the moment that you need them. And you can even become more collaborative and, help them to develop a story. I mean, certainly, many people who are part of the Lancet Commission and are involved with all of the other organization that has gone into the report were instrumental in my reporting. I did 2 stories for Public Radio International and wrote 1 story for the Lancet, and it was all funded by the Pulitzer Center for Crisis Reporting, which I should say. But they really helped me all along. I came across sort of this idea, a tweet about global surgery, right, and was thinking, well, what is this, and started to read a little bit more, some of the PDFs that you folks had posted online, and then got in touch with the Commission, who really helped me to identify some of the places to go, people to talk to, models to look at. So it was very collaborative. So I think kind of reaching out a helping hand to a journalist is always good, and establishing that relationship.
Maybe before I go on to Eric, I want to explore that just a little bit more. What specifically caught your eye? What caught your attention that made you want to go ahead and report on something here? What were the concepts that really caught your eye?
So I think for me, the 2 things, and I think if you're trying to pitch a journalist, these are 2 things to try to keep in mind. One would be the novelty, right? So the idea of just this huge disparity in access to surgical care, I was bowled over actually when I started to read about the burden of disease and of surgically treatable disease and the huge numbers of people who are going without care. So for me, that was a new piece of information. So that made me want to explore it more. So helping a journalist see what's new there, and then helping that reporter connect to the people, the faces, right, behind these numbers and these statistics, I think is really key too.
Thank you. I'm going to use Eric a little bit because he has done this Oscar-nominated documentary on open heart. And sometimes we as surgeons, we like to tell people about all the data. And yet I wonder what the real effect is if maybe it is we need to market global surgery. Maybe we need a marketing company that can help us change the name from global surgery to something else that people would like to accept. But your documentary that won this award, tell us about what you think that documentary was able to do for cardiac surgery in developing countries. As I remember, this is in Somalia, is that correct? Or is it Sudan?
Sudan, yeah.
So explain to us a little bit about how, because I think that's a great marketing mechanism that we might be able to use for what we're doing.
Sure. So what I would say is that for us, as an organization Emergency, we work only in war zones, and we provide high standard, free of charge health care to civilians, because in contemporary conflicts, 90% of those injured are civilians, people like you and I just trying to get by day to day, and 1/3 of those are children. So this is the context in where we're doing our surgical work. Afghanistan, Iraq, Sudan, Sierra Leone, Central African Republic. The list continues to grow, unfortunately. So within the short documentary called Open Heart, I also want to be clear, it wasn't my film. It was actually a very talented filmmaker named Keith Davidson and a very resourceful producer named Corey Stern who made this short documentary called Open Heart. For those of you in London, you may have seen it, the launch there. If you haven't seen it or you'd like to see it again, you can see it on HBO Go. And I think it's a really profound story that can be leveraged as a communication tool to understand the importance of global surgery and to tell the stories that make people want to take action, whether that's, we've had somebody who saw the film online, he's a perfusionist, he signed up to work with us, all of our international and of course our national staff are all paid. He signed up to come work with us in Sudan for 6 months after seeing that trailer on online. He came back, he's helping us with medical recruitment and fundraising and other opportunities. But it's really that story, so we can, in this academic setting, we like our numbers, our statistics, which are important. But to really move people to action from a communication standpoint, I would say is the storytelling. In particular, in this film of Open Heart, you follow the story primarily of a 6-year-old girl named Angie, who's from Rwanda. And she develops strep throat. Unfortunately, she just does not get the antibiotics that she needs. And her and 7 of her youth colleagues, ages 3 to 14, are flown from Rwanda to our hospital in Sudan, which is the only hospital of its kind on the continent, which provides high standard, free of charge, open heart surgery to these children. And they receive mechanical heart valves and they all survive. It's a very powerful story that highlights the resiliency as well as the capacity for hope in this area. And so that's what the film has really done for us, and has captured the mind and the imagination of surgeons as well as nurses and anesthesiologists, as well as the press. And of course, the Academy took favor to it as well.
I think this telling of stories is something that we have to become much better at as surgeons and as public health to reach the hearts of people. It's what I realized in Mongolia when we finally sent my anesthesiologist, my wife, and my resident out to a patient's gyr, a yurt, who was 4 days post having her gallbladder removed, and she was milking her horses and taking care of her sheep and taking care of her family. And she had to ride on the motorcycle 50 kilometers back to her home on the next day after surgery to get there. That picture and that story is what we gave to the Ministry of Health, have given to Mrs. Stortz from the Stortz Company. It's led to millions of dollars of equipment donations, as well as now the Ministry of Health funding the rest of the states to get that kind of care. And so I think this kind of story is something we need to become better at. I thank my Mongolian colleagues for teaching me a little bit about that. I wanted us to look at the types of media that are the best to use to get our message out. I mean, what are the most likely methods that are going to get our message out to the most number of people? I was looking at my Twitter feeds today, and I was looking up how many followers each of you have. How many of you have more than 1,000 followers? Raise your hands. Dr. Sam Finlayson, chairman of my department, that is wonderful. I knew that, that's why I brought that up. No. This is part of media public relations. How many of us have more than 500? Okay. How many of us have somewhere between 0 and 100? So, Twitter, Facebook, the news media, blogs. I'm going to open this up for each of you. What is the best form of media that we can get this message out? Because we've talked, this is going to be a 15-year project, not just 110 initial statements. How do we continue to take this forward, and what is the media method we should use? Maybe it's multiple. Let's start at the end there.
I think, a host of using all the tools that are available to us is the best way. I mean, everything from Twitter and Facebook, and from an organizational perspective, to really spread the impact of your work, but also in a non-media setting, all the stories you write as an organization, posting on your website, telling the real impact of your clinicians, of your community health workers, of the drivers, of the lab techs, of every single person that plays a role in healthcare delivery, because that does extend beyond just clinicians. And being able to really engage with them and also the patients to spread their part of this and the real part they play. And then when you come to the media and you're able to use the stories you write on your own organizational forums as pitches, because it has the baseline information you need, providing compelling visuals and photos of the work, of the settings where you're working, and using that to garner media attention. But also, there's other avenues such as op-eds, and that's a really, really powerful way to make a clear policy statement, to really change policy and affect policymakers from a global health perspective, because we can use 900 words to really convey the need and the reason why something has to change. And speaking from an organization, that's a very, very powerful way to do that.
That's something I think Partners in Health has been very good at doing, an op-ed. Let me, before I have Bridget answer that same question, how many of you have ever written an op-ed about global surgery? Just a couple of hands. And maybe that could be something that I would challenge each of us to go home and to consider. This is, we teach a course called Global Surgery and Public Health at the University of Utah. The final exam is for the students to write an op-ed about some global surgery issue and to try to get it published. The course last year, we've had 3 published. We're working on the ones that are just handing in their final exam this last Thursday. But I think it can be very impactful, and maybe that's something we each can try to do to help figure out how to take this, this message forward. Bridget, go ahead.
I guess I would just add that, you know, it may be helpful to be strategic about sort of who you're trying to reach when you know, the media is, or, you know, is sort of a broad category. So if you want to reach policymakers, say, in the U.S., you might think about placing an op-ed in a place where lawmakers, you know, read, like The Hill. If you want to reach, you know, clinicians working all over the world, you may, you know, look at The Lancet. If you want to reach the general public, you'll look at sort of more mass media. But so I think that you should really, you know, think strategically about, why do I want media coverage in the first place for this? What is the goal here? And then look at who you really want to hear the message, and then, you know, sort of start to court publications and writers, either outside your organization or even within your organization. Tailor, you know, your writing style to that place that makes the most sense for the particular topic.
Jeff.
I would add to that, find out and really what your story and what your values are. For us, we're a human rights organization, so we talk about the importance of that value and that how that provides to the uniqueness of the services we provide, and really champion and amplifying the voices of the patients and the people who come through our hospital, because these are also, you know, these are our friends, these are our colleagues, these are people we need to be able to connect with, and not just file away as a statistic, but understand that, for example, just this past Sunday, there's a story in the New York Times about a 6-year-old girl who lost both of her legs in Afghanistan, whose life was saved at our hospital. These are, you know, these are more than just number. These are peoples with lives, and that global surgery is there to help save lives, that surgical care all the way through. But focusing on what's unique, being able to really respectfully, from a human rights standpoint, tell these stories to help educate and inform people, and also inspire them and give them hope. They can be working only in war zones, can be a really tiring context to be in, but it's also incredibly inspiring and hopeful. And so finding where the hope is at, and I really think, you know, part of what the Commission has captured so much media, and congratulations on your success, and I wish you continued success, is the future. We need to look to the future. Where are we going? How are we going to get there? What resources do we have? And how can we inspire others to join us in this very ambitious mission? And then the one last thing I would say to that too would also be to work with and collaborate and trust artists, filmmakers, writers, photographers, and people can help tell your story, or the story of those people that you treat, to be able to get those stories across, to help you be able to continue to do the work that you're doing.
Wonderful concepts. I just gave a terabyte of video and pictures from Mongolia to a film student with the goal of to make a few 1 to 1.5 minute YouTube videos that we can find some poignant ways to just flood the YouTube with those kinds of stories. And so if we have video and pictures, I think would be a great way to try to do that. We have about 6 minutes left. Let's get some questions for our media panel, if we could. Right here.
Hi, I'm Shrishti Sharma. I'm a researcher at Johns Hopkins School of Public Health and a fellow with the G4 Alliance. I have a question for all the panelists and Dr. Price. I feel we have much to learn from the corporate industry. Look at tobacco or alcohol industry, for for example. They make their evil products so attractive. How can we do that for global surgery, or scratch that, for public health? How can we make public health and global surgery less grim and a little cool to attract the younger generation?
I'm going to go ahead. Let's go ahead and answer this one.
A lofty challenge.
Because I like to hear the answer.
As many have said, making health system strengthening a sexy topic is not the easiest thing, and
well, it's tough to put a hemorrhoid up on the picture like they do with the cleft palate and get some, so yeah.
And what the corporations have to make that a glorified topic is money and marketing firms, and that's something from the nonprofit world that isn't at our resource, and it really falls on a lot of us to also pick up that extra share in that task of making it something that it's accessible. But it's also at the same time is drawing parallels to the high quality care we have here in the U.S. in some of these resource poor settings where we're working. And I mean, you look at poverty, you look at food security, and those are discriminant factors that really impact people's disease and need for surgery. But look at simple forces like physics, gravity. A guy in Brookline using a ladder to climb a tree, if he falls, he hits the ground at the same force as someone in Haiti who's using a ladder. The problem is only one person is going to get the care they need as a result of falling, and both are going to have likely the same injuries. So really trying to draw parallels in terms of the benefits we have here in the U.S., here in Boston with some of the best teaching hospitals in the world, compared to some settings where women are walking 8 hours to give birth. And it's things like that that really bring the gravity of this work and the real need for us to continue pushing forward and advocating for more resources, more staff, and more all of that to make this work happen.
Let's take another question. Scott?
Thank you. Scott Leckman. I'm a general surgeon in Salt Lake City and with the Center for Global Surgery at the University of Utah. And I'm also chairman of the Board of Results. We're an anti-poverty advocacy group. So I've had some experience in trying to generate media. And we have some big barriers. First of all, in the US, Americans generally aren't interested in the world. Fox News, at my local station, they have World in a Minute. They spend world news, they do it in 1 minute. Talk really fast, and that's it. So Americans generally aren't interested in the rest of the world. The other thing that we generate media in results, we generate media to affect policy. And that's what we want to do, is affect policy. But the media, print, TV, they want to know the local angle. And so that's where we, as people interested, you can be the local angle in your community. But I think we need to be strategic. The other barrier we have, this is a chronic problem. We can generate lots of interest in an earthquake, in a tsunami, but when we're talking about a chronic problem, it gets to be much more difficult. 180 pieces of media from the launch, that is very impressive, but that's a blip. Tomorrow, it's old news tomorrow, so we're going to have to keep generating it. So any advice you have, I'd be interested. Thank you.
So again, what is the strategy we use to keep this issue going forward?
I'd like to try to connect the two questions here because I think they're related. And again, just kind of speaking from our experience as emergency, what we've found successful, and I know this is a challenge, but I know this room is up to it, is really capturing the imagination. And I go back to our human rights work and the power of aesthetics. And for example, the hospital that you can see in Open Heart is called the Sloan Center for Cardiac Surgery. And our head surgeon and our head architect got together 10 years ago with this idea, and we got a lot of pushback. The one major aesthetic requirement from our head surgeon was to make it scandalously beautiful, right? So and since then, this hospital has gone on to not only provide life-saving surgery, but also to win architecture awards and design awards and to inspire other hospitals and other healthcare facilities to understand the importance of aesthetics within the healing process, and inspired many photographers and filmmakers to come and visit. So there's these larger creative initiatives that we all have that inspire people, that are interesting to people. And that then leads to having some other national media attention that we've had, and I definitely relate with you. These things kind of come and go. In 1 week, I had 9 interviews during Ebola, from everything from the Wall Street Journal to the San Francisco Chronicle, and then, but I couldn't, for the entire year, I couldn't get anybody to talk to me about Bangui and the war in the Central African Republic and the children who were being slaughtered there, to be frank. But this local connection, I think, is really important, and going back to leveraging the resources we have, with these 110 media hits already for this commission, that gives all of us in this room third-party validation to say, this is the work we've been doing, or this is the work we're interested in, and now is the time. Between now and 2013, this is the future of global public health. And we're here today, as we mentioned here in many other panels, this is the beginning. And being able to leverage that media, and all of you here are your local connections, and or have other local connections to reach out to that local press and build the relationships that Bridget mentioned that are so important. Because we all need to think about long-term relationships and capacity, and forming those so that people get to know you and understand your passion for this work, and be able to hear those stories of those patients through your experiences, and that's going to inspire others, and to keep this story going, because it's a very important narrative. A lot of work has been put into this, and now it's up to the rest of us to be able to come together as a community, and the Commission has been working so hard to pull together and build together and really support each other and champion each other. And I think Partners in Health is one of my favorite organizations. They're fantastic with their communications. So if you can't do it, don't know what to do, I recommend going over there and checking out what they're doing, and finding a way to adapt it to your organization. But I think there's a lot of momentum that we can just keep going from the connections and resources that have already been provided to us from the Commission.
Thank you very much. I'm going to actually let Bridget have the last voice here, as we're out of time. Go ahead, Bridget.
Thank you so much. Just quickly, one thing to keep in mind here is that most of you are gatekeepers, and so one thing that you really have that most, that journalists certainly don't have, is the power to sort of let people into your work. And I think that one thing that does really grab, an apathetic public's interest is being able to go into a place where they can't go ordinarily, right? And so a reporter can take them somewhere. So, from the reporting I did in Mozambique, I mean, the things that people commented most on were not the statistics, which to me are totally, staggering. It was the personal details, seeing a woman whose C-section had been put off for 12 hours because the power had gone out, seeing the way that her toes were clenching with every contraction she was having. And that was the detail, that you only get by being in an operating room. So I just think, obviously you have to balance the interests of your patients, who are the most important, but I think that to the extent that you can kind of invite journalists and other storytellers into your work and your world, I think that will take you far.
Fantastic ideas, and thank you very much for coming and participating today.